Now, nearly 1 in 4 adults aged 40 and above in parts of Ashanti region are at risk of developing dementia, exposing major gaps in Ghana's readiness to tackle the growing public health challenge. Health experts are now partnering with UK researchers to improve early detection, diagnosis and long-term care through a dementia referral pathway. But they warn Ghana's health system remains ill-equipped, leaving many patients undiagnosed and families without adequate support. Martha Sewabwache reports.
Country Project Director Joshua Okyere says new evidence shows that 23.4% of adults aged 40 and above in the Ashanti region are at risk of dementia, describing it as an emerging public health concern.
For today, we had a workshop to disseminate some research findings and also do a co-creation towards development of a dementia care pathway for Ghana. And so we realized from our past research in 2023, between 2023 and 2025, that in Ghana, and purposely we focused on the Ashanti region then, people aged 40 years and older, among them 23.4% had risks of dementia, which is very high, and it's telling us that we need to do more for our country. But what we've realized is that our dementia care system in Ghana now is highly fragmented. So it means that we need to do more. We need to have specific guidelines showing when to refer, what to do next, and even issues of palliative care for persons living with dementia.
Principal investigator and senior lecturer at the University of Huddersfield, Professor Precious Adade Duodu, is calling for a national dementia policy, a clear referral care pathway, and stronger early detection systems to improve care for patients and support for caregivers.
In Ghana and all over the world, everybody wants to live long. And as we know, old age is one of the major risk factors for dementia. In other words, every single human being is at risk of developing dementia. I don't know whether it will be me or it will be any other person. And therefore, we all have to put our hands to the wheel and make sure that as a country, we have clarity on what to do when someone is showing signs of that. Therefore, my appeal to the government or the president and the ministry is that I should say that they've collaborated with us on this project. They've been key in organizing this, and I want to emphasize that. And therefore, from here, we want to see a much bigger collaboration for them to take up what we have done and make sure that they own it locally and it is expanded or implemented across the country. So that's what we are looking for, and of course a bigger collaboration. And from here, the idea is to again collaborate with the government and the ministry to be able to develop a dementia policy for Ghana.
Experts believe combining policy reforms with community-based social interventions will strengthen dementia care and improve the quality of life for Ghana's aging population. For JoyNews, Martha Sewabwache's report read to you.